Thank you for all coming. It's always a little daunting when you look out in the audience and you see many people who know as much or more about the subject matter as you do. But thank you for your attendance. And welcome to the Hearing Review's CareCredit Symposium, Aligning Price and Services with the Patient's Path to Purchase. I'm Carl Strum. I'm the editor of the Hearing Review magazine and its website at hearingreview.com. We've got a great symposium lined up for you today. And before we get started, I just want to thank CareCredit for their willingness and vision to drive this project, and particularly Randy Baldwin, who will be up here speaking in a few moments, Echo Huang, Matt Baller, and as well as Nancy Kent and Kristen Peralta. I want to thank HR Hearing Review staff members, Dana McLean, who's our publisher, Courtney Riley, our marketing manager, and Krista Newber, my associate editor, for all the work that they've done on this. I'd also like to recognize our big cheese, our big cheese bosses here, Don Ransdell with Anthem Media. Thanks for coming, Don. There are just as a matter of housekeeping, there are CEUs available for this. I'm supposed to flash a card that I have here at the end of the thing. I think you all have decoder rings that you decode, and it says "Eat more Ovaltine" or something like that at the end of it. I'll go through the schedule here. There we go. Essentially, the symposium is composed of two presentations. Randy Baldwin will be presenting research from CareCredit about this really interesting path to purchase research that they've done. CareCredit's a unique organization, and not only do they focus on audiology, but they have a lot of other disciplines and verticals that they go across, and they've got a lot of really interesting insights. Then I'll be, and that will take 20 minutes to half an hour or so. Then I'll take 20 minutes to half an hour to present our 2016 Hearing Review pricing survey and the information from that. And then we'll call up a panel that includes audiologist Wayne Staub and Shagata Bhattacharya, along with a dentist and dental surgeon, Dr. Howard Ong, and Bernie Stoltz, an expert in practice management. And Matt Bowler from CareCredit will be chiming in from time to time with his thoughts as well. It ends at 3:30, and then we'll have some hors d'oeuvres and cocktails in the back, and time for one-on-one questions. After the end of each presentation, we'll also have some questions, as well as opening it up during the panel discussion. We are filming this, and we've done several of these events, and the video clips will end up on a new community website that Hearing Review and CareCredit have developed. On that website, that's at business.hearingreview.com. On that website, we've got a lot of great information, along with about a dozen webinars that we've done, and there will be articles from Randy and my presentation as well, and those will be appearing in the Hearing Review as well. I have scheduled my article in July if you're interested, and I haven't pinned Randy down yet, but I will on the publication schedule for that. Also, at CareCredit's booth, they are offering what's called the What Works Toolkit, and that's booth 254. This toolkit has all the relevant information or a lot of the relevant information that you'll be seeing on my pricing survey slides. So stop by the booth and get that. Speaking of the state of, it also has a lot of information from the State of the Industry meeting that we had in 2014 in Orlando at the AAA convention. And in that meeting, we had presentations from Brian Taylor, who talked about interventional audiology, Amin Amlani, who talked about unbundling and price elasticity, and Dan Quall, who talked about KPIs, key performance indicators, and developing a dashboard for your practice. And if you were to have kind of an overriding elevator pitch summary for that, I would say that there were 3 or 4 prevalent themes that came through. One is that competition is getting tougher for developing in more channels for hearing care professionals. No big news there. ASPs and profit margins are starting to erode, and dispensers will have to dispense. It's quite possible that in the future, or maybe you're feeling it now, the dispensers may have to dispense more units at lower margins. And that means that you'll have to become more efficient in both developing best practices for both your clinical protocols and your business practices. So unlike the State of the Industry dinner, which had all those things and saw things from kind of a practice and business perspective, this session will be a bit more from the patient perspective, and kind of a State of the Industry dinner through the looking glass type of thing. To paraphrase Lewis Carroll and through the looking glass. So we're going to be looking at the shifting sands of hearing healthcare. And increasingly, I think in hearing healthcare, what you're seeing is that the consumer is really the one that's calling the shots. It doesn't matter what bloviating editors like myself think or advise. And I know there's a lot of very influential and through the noble efforts of the professional organizations and the trade organizations that several of you belong to and some of you represent, we can kind of point out where the landmines are for the consumer, but the consumer is definitely driving the bus. And it's really up to us to be trying to get our products and our services in front of wherever they're going. And we can point out the landmines, but it's the consumer that is driving healthcare in general. And Brian Taylor just did a webinar for us a couple weeks ago, and he has a really interesting quote in it. He said, "Your business needs to be defined by what by what consumers want, not by what your practice is producing." I think that's a pretty dynamic shift in the delivery of healthcare. And for us, it points to a need not to dispense a product or hearing aid per se, but to really understand the wants and needs of each individual patient. Accessibility and affordability continue to be the big buzzwords of the hearing industry. You'll hear it over and over again in conferences at this convention. And it will bubble up to the top of a lot of the things that we're discussing here. The IOM, the Institutes of Medicine, and the PCAS, the President's Council of Advisors on Science and Technology, are all very interested in these questions. And I think we'll have some great discussions here today and some great information that sheds light on a lot of these really prevailing issues in our industry. So we've got a great symposium lined up for you today, and I want to point out our industry host, CareCredit, and Randy Baldwin will be providing you with the results from an extremely interesting study that his company did on the hearing aid market, as well as results from several verticals that they serve. And as you probably know, CareCredit is one of the leading healthcare financing companies in the U.S., and they're a very unique company to work with because they all have all these verticals, whether it's dental or audiology or veterinary care, optometry and vision and cosmetic surgery. They work with a lot of different practices and see a lot of interesting trends in all of these practices. So they're kind of like a Switzerland of the healthcare world in that they see things transpire and they really kind of, at least in audiology, they've been very entrenched and involved in it. So for our first presentation, I'd like you to please welcome Randy Baldwin, Director of Marketing for CareCredit's Audiology and Vision sections. Randy?